something, and we're echoing here? You hear an echo?
Just the microphone.
That's microphones.
Okay. BCAT, I called the meeting to order.
That's only for you.
Called the meeting to order again at 7:01. Before we begin, I want to acknowledge that the town of Burlington lost last month a very important leader within our community. Virginia Mooney spent 47 years as a Burlington town meeting member. She was a selectman. Her commitment to this town was just outstanding. She's clearly dedicated. She supported this board and was a member of the Burlington Volunteer Reserve Corps, and she represented all that is good within this community. I'd like to stand for a moment of silence, and then we'll go directly into our Pledge of Allegiance. Pledge allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We have approval of minutes September 11th, 2018.
I move we approve the minutes for the September 11th, 2018 meeting.
A second?
I have a motion, a second, to approve the minutes of September 11th, 2018. Is there any other discussion? If not, all in favor?
Aye.
Citizens' time, is there anybody
Abstain for me.
in this audience who would like to speak to the board who is not on the agenda? Seeing none, we can move on to applications for special permits. 55 Network Drive, Sarepta Therapeutics.
Good evening, Mr. Chairman and members of the board. Pleasure to be before you this evening. For the record, Attorney Mark Vaughn here tonight representing Sarepta Therapeutics in connection with their application that's been submitted to the Planning Board. They are very anxious, excited about the opportunity to locate here in Burlington at the property at 55 Network Drive, which is, I still continue to call it the former Sun Microsystems campus, but I know that's going back some years, but it's a fully built-out campus that's up in that location there. They're going to be looking to reoccupy existing square footage that is within a building at 55 Network Drive, approximately 44,000 square feet of space. Same space that was formerly occupied by Dyax Corporation, which was another biotechnology company that was located in that very same space. So Sarepta Therapeutics is a biotechnology company presently located in Cambridge. They are a leader in their industry with a primary focus on medical research, drug development, principally designed to combat rare genetic diseases. Very exciting company, something that certainly I think Burlington would be proud to consider them a citizen here, I think, in terms of, I know that the town's desire to attract and retain companies like that are on that cutting edge of the life science industry. So with me tonight is Jay Karima, who is the Director of Environmental Health and Safety for Sarepta. Suffice it to say, they have other locations in Massachusetts. I think they're fully up to speed and knowledgeable about what goes into their business and what they need to do to be compliant with local Board of Health requirements in terms of material safety and all that goes along with it. They know what they're doing and they do it well. So we have submitted special permit applications to the Planning Board. We're before them next week on those, and I know communications with staff, they've had a chance to develop some comments, which we've had an opportunity to issues with those at all in terms of what would be required of us. So happy to answer any questions, or if you have any of myself or Jay, but I know that they're very excited about the opportunity to locate here in Burlington. It would be about 100 new jobs, I believe, that they'd be bringing to town. High-paying jobs. You've probably seen that industry tends to pay well through scientists and other folks that they have. So exciting.
Christine, our environmental engineer, do you have any comments?
Just a couple of comments to add to what Attorney Vaughn has stated. Sarepta will be a small quantity generator of hazardous waste, so that's one of their special permits they're applying for. The other one is for laboratories engaged in research, the third for storage of toxic and hazardous materials. They'll be utilizing our DNA under either biosafety levels 1 and 2 containment. We'll see that more flushed out in the actual RDNA permit, which they have just filed today, and they'll be appearing before you for that separate filing. They will be forming, as part of their RDNA permitting effort, an institutional biosafety committee, and that will need a member of the community, and that's part of the next phase under the discussion. We can get to that.
I'm sorry, you're Doc,
Jay.
Jay. I'm sorry, it's Dr. Jay or
No.
it's
Just Jay Karimas, is it?
Karima?
Karima, C-A-R-I-M-A. Yep.
Mr. Karima. Does anyone have any questions for Mr. Karima or Mr.
Have
Vaughn?
any for
Well, I do.
that or Christine?
I'm not surprised.
Either am I.
Me either.
I know your company. You have one product at this point in time, correct?
Yes, sir.
And it's for Duchenne's muscular dystrophy. What are you going to be doing at this site? I know that you have multiple products in discovery, preclinical phases 1, 2, and I think you have 2 or 3 drugs in phase 3. So what are you going to be doing in this site? Are you going to be manufacturing?
No, sir. We're going to be making non-clinical material for testing at other facilities, including scale-up for manufacturing at contract manufacturing.
So you do no manufacturing here whatsoever?
No.
Okay. I just want to point out, I've read everything, I've reviewed, and I really, Mr. Vaughn, I really have no objections at all. Proposed condition number 1, I just want to read because I want to make sure the community understands that the applicant must adhere to the Town of Burlington Board of Health regulations for the use of recombinant DNA technology and the most recent publications of NIH's guidelines for research involving recombinant or synthetic nucleic acid molecule. And if that changes, you will need to obtain a recombinant DNA permit, which we received an application for today, and we will review that for the next meeting. You'll utilize a biosafety level 1 and 2, and if that changes and you need to go to 3, you'll need to come back here. And then again, number 7, and that is following approval of recommendations by this board, any changes in laboratory scope of work will be submitted to the environmental engineer to determine if an appearance before the Board of Health is required. I just want to make sure that this is understood by a new company that we're very happy to have in this community. But you understand that if you begin to do other types of research, we need to know about that.
Oh, absolutely. Yes, sir.
Okay, and you acknowledge that as
Yes, we do.
okay. I have no other, does anyone else have any questions about the company whatsoever? Okay, then I can entertain a motion.
Can we do this in one motion, Susan?
No, we
or
really need this in 2.
Three motions, I guess.
Actually, an application first, we have to approve the special permit. And
Well, the
then-
special permit is 3 different, there's 3 different special permits, right?
There's one, too.
You can just do one.
You can do that one.
It's
Just
all
do
under
the
one
All
permit?
under one
Okay.
permit, it's only under one
Okay.
permit. So I need.
So I'll make a motion to approve the special permits for Sarepta Therapeutics, Inc.
I'll second.
I have a motion second. Any other discussion whatsoever? Susan?
No.
Okay. All in favor?
Aye.
Great. I wait before I say welcome to Burlington. We now have to approve a community representative. We have to nominate for your institutional biosafety committee, and I know this is not your first rodeo. You understand how this works. And Christine has recommended Jim Harrison. He is very well known in the community. He is a chemical engineer. He's not only served as a town meeting member, but also he has served on this board. He's an outstanding scientist, and I'm going to ask for a nomination for his position as a community representative to the Institutional Biosafety Committee.
I nominate, is it Jim Harrison?
James
James
Harrison.
Harrison to be the representative to the Institutional Biohazard Committee for Sarepta.
I'll second it.
I have a motion and I have a second. Jim, if you're listening, we thank you so much. Or you're watching, we thank you so much for doing this. I know that you have participated in these committees for the town of Burlington for many years, and I know how great a job you do, and we thank you very much. All in favor?
Aye.
Well, you're two-thirds there, and we're now going to wait for you to come back to our next meeting for an RDNA permit.
That would be great. I look forward to having that discussion with you at that time, so thank
Okay.
you very much.
Thank you.
Thank you.
At that-
Welcome.
Very much.
At that
Thank you.
time, we'd really like to know exactly what you're going to be doing in a very non-proprietary way. Okay? Thank you very much.
Thank you.
Thanks for coming in. Have a nice night. Take care.
you.
From a new company to a very established restaurant in this community. Thank you for coming here, Mr. Murray. I'll leave this to who will, okay, Susan, please.
Cafe Escadrille is here to discuss their variance. 2 years ago, they received a variance from the grease interceptor regulations to utilize the protein matrix solution, which contained a number of conditions. And those are provided in your packet, all of those conditions. They're at the end of that 2-year cycle now, and I've also provided here a timeline of events that happened within that past 2 years. So it was October in 2016 when they received the variance. They had 4 inspections in year 1 at the beginning, and then at the end of year 1, they came back to the board. There was no issues identified at that time. In the beginning of year 2, there was some complaints received about sewer backup. They came to Board of Health meetings 2 times to discuss that. We've had DPW cleanings of the main sewer lines. They've been working with the Board of Health Subcommittee to figure out, what may have been the cause of that. They've done cammering of the lines. They had recently done an additional cammering of the lines yesterday, which I haven't had the time, I got last night, so I haven't had the time to review that yet. So we're here to discuss the end of the 2-year variance and how to move forward with their variance. So I conducted the last inspection on November 5th, and that was the year 2 second inspection. And at that inspection, the system maintenance company that they are now using was present, and I went through how they would do their inspection with them. I didn't notice any problems or issues during that inspection. I haven't noticed any in the past at all in previous inspections. I provided the board with recommendations to move forward with the variance. And those include 6 recommendations. The recommendations 2 through 5 are 2 through 6 were provided in the original variance. It's recommendation 1 that's different from the original variance. So that would be that they have a system maintenance provider that's responsible for inspecting maintenance and dosage adjustments of the protein matrix system. And they, within 2 weeks, they provide their reports to the Board of Health. So every time that the systems maintenance provider goes out and does an inspection, they should provide a report to the Board of Health. These should be written reports, and they should be provided to us for the lifetime of the variance. So these 6 conditions are what I'm recommending for the variance moving forward. I'm also have an additional recommendation where, that because John Sanchez, the DPW superintendent, has reported that the issues of fat soil grease in the main sewer line along Ray Avenue still exist, because they're still seeing problems out there, and they're still doing the monthly cleanings. So my recommendation is to continue with a subcommittee of the Board of Health along with the DPW to investigate what problems, what solutions we can come up with to solve the problem out there on a permanent basis, so that the town can reduce their monthly cleanings, or do cleanings less often.
Do you have any comments? I just got a
I do.
question. Okay, well, I'm sorry, please.
Just the additional recommendation, Susan, and you say main sewer line, is that affects all though it's not just directed, right? That main line, is that?
The additional recommendation? Yeah, so what I'm saying is I think the subcommittee should be formed to not address
Yeah, that's what I was
the
thinking. It's
Cafe
separate
Escadrille's
from the
lines,
escadrille.
but to address the main sewer line along Ray Avenue.
Okay.
And,
Yeah,
and I
would
don't know
agree.
how, if they might, how they would come into play with that or not, and I'm sure if the subcommittee wanted them to come in to discuss something, they would be willing to do
Yeah, we'd
so.
be willing to participate with
Yeah,
whatever we can to try to figure out where it's coming from.
Right,
what the
that's what I was
problem is.
thinking. I agree with that you added, though. I just wanted to make sure it was the whole main. It was,
I just want to point out that Cafe Escadrille and Mr. Murray have been extremely cooperative and helpful, and we all want to make this work. I just had a question, and that is, could I address it too? We were hoping that the DPW would be able to reduce the schedule of monthly cleanings for the main sewer due to your product. Do you have any reason why we still have this problem and we still have to clean it twice a month?
Mr. Chairman, just for the record, Paul Denaro from Protein
Yes.
Matrix, so you have in the record of today's meeting anyways. We're perplexed from the point of the product site and then the buildup that's happening out in the main. I personally was there during the cleaning processes and the cammering processes, not the one that was done yesterday. I was not present for that. And honestly, it was very telling of a long-term buildup that was significant. So at our company's expense, along with the DPW, we did the cammering, but in addition to that, the cleaning that took place, it took multiple cleanings just to get rid of the old buildup that was there. Having said that, they're still finding that they're having some residuals in the lower section where the main actually flattens out a bit and it connects from over the hill. You've got a main interceptor that goes off to Woburn, so that the water flow is restricted and everything settles at that point, as opposed to flowing right through the line, because there's so much volume that comes from over the hill, especially during the daytime. But the solidification of grease on the property of the escadrille has been removed. So we don't actually know what's causing it.
Is that true for the external grease trap as well? Did you inspect the external grease interceptor?
well, they open it up and you
Yeah.
kind of look down.
Yeah,
and
but
they
I
get a
think one of the
rod.
times, one of the subcommittee meetings, they looked down and it was like wax cracks, right? So, and it's supposed to be more fluid. Can you observe whether it's more fluid?
What I observed was that it was, well, at the end of year 2, in November, when I
Yep.
looked at that, it was less fluid, so you could tell that there was more product on the top, but that was time to do another cleaning, and it's time to do another cleaning now, because they're ended the second year, I don't know if you've done that yet, but an entire cleaning of the whole tank.
No, we did another cleaning in the summer when we did all the lines.
Oh, of the
Yeah,
tank?
Yeah, the
We
tank
did
was.
the
Oh,
whole
so
cleaned
that
as
may
well.
be, because,
So that's like our new starting point for the year for the
Which is the
variance.
summertime, right?
Yeah,
When you
yeah.
kind of started from
okay,
scratch, right?
because what I was gonna say is at the end of that year, then you would expect to see that's gonna be more buildup in the tank, because there was no cleaning done, and I didn't see that in November, but that's probably why, because they cleaned it all out over the summertime. So when I saw it, it was fluid in there, so it was more fluid, same really that it has been every
Right,
time.
every time you were there, which is
I've
normal,
been out there.
which is normal,
Yeah, I mean, it's, well,
except for that one time where it was,
I didn't see
You
that,
didn't see,
though.
but
That
the-
was what they
yeah,
reported.
that's what they reported, that
Yeah.
it was more solid.
Right, and that was after that, they had the issues, though, with
Correct.
the timer and.
Yeah, the
they
timer
lost
and the
electricity
dosage and all that,
dosage.
yeah.
Now, they had increased their dosage significantly after this incident happened, and now they've reduced it back down again. It's been reduced down, but it's still more than it was in
Right.
year 1. So it's still higher than it was in year 1, but it's been reduced significantly from the summertime. So that's why I have condition 1 in here, because the dosing is really important. It's really important for you to be up on what the dosing should be. And especially, I think that maybe in busier times, where you have more fats, oil, and grease coming in, you need to increase that dosing a little bit. Like, you might not be able to keep the dosing the same throughout the whole year, depending on how busy they are. So they really have to keep track of that.
Sure.
And keep on top of it, I think, for this to work.
We should be able to monitor that with the monthly inspections.
Yeah,
so.
and when they do the monthly report, they will report in there what the dosing is, like whether they've changed it or not. So if we see anything might have happened, we can go back and take a look at those reports.
So just to be clear, for everybody listening, the effluent through the grease interceptor, and as it goes down the main line and gets shuttled off to wherever it goes, should always be a somewhat liquid, free-flowing substance. That's the
Anything that gets-
expectation.
anything
And
that gets
except,
through the
and except from my understanding, my recollection, and except for one instance, that has always been the case.
Right, and it exists now, so
Correct.
we have this conundrum, if you will, as to why, if this is liquid and it's maintaining its flow,
Yeah, I guess-
we're building up
I
at
guess
the
that's my
end of
question, and
the.
this is probably.
And that's what I'm concerned about.
Because the DPW reported to me that they still are seeing problems when they're doing the cleaning.
Right.
So they're doing the regular jet cleaning out there
Right.
once a month, and they're still noticing a lot of grease.
So,
I guess, well,
I'm sorry, go ahead, please.
Well, I don't know if this is the point to bring it up, but are there other businesses that may be part of this problem?
Well,
And
that's
it's
what-
not solely the problem of one.
That would need to be explored
We need
by
to
the
explore that,
subcommittee.
Yeah,
right.
I
And
think-
we
I
certainly
think
have
we
talked
need
about
to.
that, right? And I guess my question is, and this is a whole nother conversation, right? Where does their responsibility stop for the
Correct.
fog
Correct.
maintenance? And it becomes another issue or another
A
problem.
larger issue,
Right,
if you will.
You know, unfortunately, tonight, we have to.
can't.
Yeah, I know, I'm
We
just.
can't get into that because
just-
it's on this just for the variance.
Right.
So are we approving this variance or just continuing it with the, do we have to vote on this at all? Or is
Yes.
it-
Yeah, 'cause it's a
Yeah.
change.
Vote
Yeah,
on this.
because the conditions are changing.
So we're approving this variance, is that?
Yeah. Because they met a lot of the initial conditions that we had for
Right.
the 2 years. They've done everything that they needed to do. So now we have to move forward with how the variance is gonna be in the future, with these 6 conditions.
Okay.
Mr. Murray, do you have any concerns with the added conditions that are?
No, I
listed?
think that's fine. We've been doing the monitoring of the monthly
think it makes
monitoring
sense
for the last
anyways.
few months
Sure.
now, and, like Susan said, she was out there about a month ago and met with, the person who's doing the reports for us, and so they, got the what she would like to see on the report, so I think we've got that all lined up, so we're just moving forward, schedule it month to month, and like Susan said, monitoring dosing. We actually have another inspection tomorrow, and I know December's our busiest month, so, you know, if we see any elevated levels now, or I might even, you know, suggest adjusting it up a little bit just for December, and then we can push it back down and just try to go, and we'll have the records, so next month we can look and see what we did for December next year and just stay ahead of it as best we can.
And keep those records cumulative, so that, you know, this time next year or 3 years from now, you can go back and say, well, yes, in December, this, and this happened, and we're going to do that.
Right.
Well, I need a motion to approve, if there are no other comments, the variance with the 6 conditions.
Mr. Chairman?
Well,
Okay.
7.
Is there,
In the
Well-
additional,
Well,
it's
with the addition
additional.
of the
Okay,
subcommittee, that's not a variance.
That's not on them,
No.
you know,
Oh,
that's just
okay.
a, yeah.
So, Mr. Chairman, I'll make a motion to approve the modified variance for the Board of Health grease interceptor regulation.
Second.
For the Cafe Escadrille.
I have a motion and second to approve the variance with the changes and the 6 conditions. All in favor?
Aye.
Mr. Murray, Mr. De Niro, I wish you a wonderful holiday season.
Thanks for coming in, appreciate it.
Thank you.
Thanks.
All right, environmental engineers report.
Just one thing to highlight for you. Under my section on MCP environmental reports, you'll note that the former Ultratronics Building 37 and Semicon Building 28 MCP sites are now partially inhabited by Lifetime Fitness. They're up and running, and during this most recent report for that site, they did the testing of the subslab vapor barrier system there and had no detections above thresholds in either the air samples sampled indoors or in the space between the soil and the vapor barrier. So it's in and it's working.
Great, thank you.
That's why we asked to have it put in. I
That's
guess.
exactly right. Because as you'll recall, that's above the plume coming.
Right, yeah, I remember.
Yeah. Any questions on my report otherwise?
Questions?
I don't have any.
Installation of the slab vapor barrier at the former Sears Tire. Did that go well?
Yes,
Okay.
that's in.
And that is a passive barrier, correct?
Yes.
Okay. And with the MCP environmental reports for electronics, are they doing any monitoring, any groundwater monitoring?
So, yeah, they still have that network of groundwater monitoring wells, the original wells. Some were, I believe one was relocated because of Lifetime Fitness, but it serves the same purpose, and it was approved by their LSP. So that's an ongoing requirement under the MCP for that MCP site. And so that's 2 distinct reporting sections for the same, or reports for the same site. So this is for the Lifetime Fitness building that sits above the site, and they have a requirement to do that air monitoring periodically. But the site itself has an ongoing obligation to sample those groundwater wells in that network around the intersection of 4th Ave and Middlesex Turnpike.
Do we know, probably an unfair question to you because it's different, but just, do you happen to know what the Altronics 37 and Semicon 28, are the numbers going down?
Yeah, but they're still detectable.
Are they doing just natural?
No, they're doing pump and treat there. So they've got that just off of North Ave. They have a pump and treat system there, and they had 2 recovery wells or capture wells. They put a 3rd one in about 2 years ago to try to increase the capture of the contaminant. They've seen a little bit of influence of that 3rd well, so they're doing pump and treat and the groundwater monitoring.
Thank you very much, that's all I have. Do I have a motion to approve the environmental engineers report?
So moved.
Second?
I have a motion second to approve the environmental engineers report. All in favor?
Aye.
Aye. That's 4-0. Supervisory nurse. Well, this is the first time, so why don't you take a minute, introduce yourself to everybody looking in, tell them who you are, where you came from, what you did, your experience, and what you'd like to do for the community.
Well, my name is Christine Pollock. I am a registered nurse. I worked at the Public Health Department in Nashua, New Hampshire. I also was a school nurse in Nashua for 14 years. I was a paramedic. I've been pretty well-rounded with pediatrics and different areas of nursing. And I have my master's degree in nursing education, so I feel that I can bring to Burlington as a nurse educator, provide some educational that's needed to promote some health awareness and disease prevention and promotion, and also provide some community-based activities. So I'm only on the second week on the job, so I'm hopefully a little bit more time. I can, get a little bit more information to see what the needs are here in the town, my hometown, actually.
Well, welcome, we're lucky to have you.
Thank you very much, and a warm welcome.
Welcome to
Great.
Burlington.
Sorry.
You've clearly been very busy, very. I mean, I'm
So,
looking for
yes.
just,
They put me right to work the first
They
day.
sure did.
I,
I'm very impressed.
and I'm glad, because I was able to do obviously the town of Burlington's flu clinic, which gave me the experience to see how it was run, and what my role was going to be. So I've been acclimating myself to my job, and also the protocols and procedures for the dispensing position. And so I've been just kind of reading things and looking into things, and been doing some flu clinics at the Board of Health. We had the high-dose clinic there, and I also did a couple of the schools for employees, so I've been a little busy, yes.
You volunteered at the flu clinic,
I did volunteer for the flu clinic.
which is just.
Yes, I wanted to see.
So, I just gotta acknowledge this, and you worked all day. I was just so impressed. Thank you so.
Thank you. Thanks for having me.
Thank you. Are there any questions?
I just have one. Are you getting still a lot of calls for flu shots?
Actually, we have some doses left, so I did schedule some time, Thursday afternoon, from 2 to 4, and Friday from 10 to 12 for those that want to come in. We do have some high dose left for those residents that are 65 and older, and also we have about 90 doses left of the regular flu zone.
Good, I just wanted to let that be.
Excellent.
Great,
I have a
thanks.
question. Was there any final disposition on the Fox Hill School absenteeism issue?
I did touch base with the nurse there, Melissa, and the absenteeism, as far as Monday was concerned, had decreased tremendously. So I think the
Yeah.
weekend kind of helped, and them doing a diligent cleaning and hand washing, and the parents taking care of what they have to do at home.
But we have no idea what hit them.
It was just a GI, it was a
Oh, I know.
gastrointestinal. We
I'm an
don't
interested
really know exactly what it was, but it got
Okay.
under control, and luckily the weekend was in our favor.
Rapid onset, rapid
Yes.
resolution.
Exactly.
Dr. Saltzman, our chairman, is in Europe, and he did weigh in to remind everybody the most important thing you could possibly do, as he reminds you every single week, is please wash your hands. Hand washing is so important, weighing in from Italy. So, if there are no other questions, I'll ask for a motion to approve the supervisory nurses report.
So moved.
Second?
I have a motion and a second. All in favor?
Aye.
4-0. And lastly, our Director of Public Health.
Yes, so just a reminder that next week is our volunteer appreciation dinner. So if you're planning on attending, if you haven't let us know yet, just please let us know.
And the date is?
It is
Fifth.
the 5th, December 5th, so at 6:30,
It's a Wednesday, correct?
Wednesday, yeah.
Yeah.
Thank you.
I've also, this week, I've applied for a $1,000 grant for the 3 portable copiers and a screen, they're called porta walls, that we can put up and use at the drill next year, the flu clinic drill, in response to what came out of the after-action report. So I've submitted that, and that will be going to the region for a general coalition meeting for a vote. That's the way that we're doing it now. And the funds will come after that January meeting. So I should be able to purchase that stuff by the end of the year and have it for next year.
So what's the whiteboard for at the drill?
The portable copiers and what's
Right, I
called
understand
a
those.
porter wall.
Right,
So the porter wall is as a barrier, so because the hallway from the registration to the dispensing area is so small, you can't hold many people in there, so there was an issue with the flow. So the idea is to create this wall in the dispensing area and shift the dispensers, so that way people can queue up in a line within the dispensing area.
inside the gym.
Inside the gym itself.
Oh, I get it.
That's a
Rather
great
than
idea.
in the hallway.
Yes.
So I thought we could try that and see.
See how it
If that
works.
worked, yeah, so, but
Yeah.
you really need to have that barrier though between the people waiting and the people dispensing, because.
Right, you do.
Yeah, so
Yeah.
that's why these porta walls, they're pretty cheap, they're only $69 for like a 6-foot, and it's really just like a curtain.
They do that at my work too.
Oh, really?
Yeah, that's what they do for the food clinic there, yeah.
Yeah, so they looked really good and, hopefully
Yeah.
they'll be paid for by the emergency.
And then
preparedness.
depending on, the decisions that we make, the whole idea of 2 lines for families versus, singles.
Yeah, that's another thing, that we need to work on, so some ideas for that, which I wanted to meet with staff first, so we're gonna
Right,
discuss it at our
but I just
staff-
wanted to make sure that was still in the,
Yeah, so the idea would be to make things like doing trainings for the MRC nurses on how to
Yep.
dispense. Because there was a couple of nurses who said to me, I would be okay with giving to children if someone would just give me that training.
show me how to do it
Yeah,
again.
yeah.
Review me.
Right, so hopefully Christine, it's something that Christine can do, yeah, as we, get into next year.
Okay. I
Yeah,
just
so
wanted to make sure
That's
it
one idea,
stayed
another
live.
idea is to, there was a few things that we
Yeah.
tried to come up with. So
Okay, I think the wall's a
After
great
you get the
idea.
after action report and you think of anything, just let me know. Yeah, so that's
Did you
that.
did you get feedback from, I know
Yeah,
sometimes you get, yeah,
from the surveys, we got a
Yeah.
lot of feedback, and that was all put into that after action report,
okay.
which you'll be getting.
Yeah, I figured you would share it with
Yeah.
us, thank you.
Another thing is, I just wanted to make the board aware, I'm sure you're all aware of I have something in my report on the FDA. They are going to be banning the flavored,
Yes.
Yeah, I saw that.
cigarettes, yeah, and so they'll only be allowed in the over 21 stores. And I think that's it, I don't know, any questions?
I have one, the beaver situation.
Oh, so that, on Old Concord Road, Old Concord Road is a private road. And it's owned by the owners of H Mart. So I spoke to the management company for H Mart, made them aware of the situation. They were working with the owners of Bed Bath and Beyond because the beavers evidently are located on their property.
I know where it is now.
They cleaned out a culvert today, so at the time when I talked to them, it was a public safety hazard. It was a nuisance, having the road like that, someone could have gotten hurt. So, they decided to close the road until they could, investigate the situation more. So, yesterday, the owners of Bed Bath and Beyond, the management company for them, contacted me, and they were going out this morning to clean out a culvert. So they did that this morning, and the road's okay now because they cleaned out the culvert. I don't know if it's gonna come back or not, so it's possible it could still be a problem if the beavers go back, and if they're the ones blocking up the culvert, then that could be, it could be a situation again. So then, if that happens, I'll have to recontact the owners over there, and they'll
Is
have
it
to
the
work again.
private road?
It's a
That-
private
the private
road.
that
It's
goes
that
out to
back-
the-
it's the
yeah,
back-
It's like
back
that back
entrance,
road to
like-
get to like
Yeah.
the,
You
Right.
go from Blanchard.
Right.
yeah.
Right,
Yeah.
in the back way.
Right in front
Yeah,
of
I've
the
driven-
condos there.
Yeah,
That would be
yeah.
great.
because it's been flooding over, yeah.
Is that road need to be accessible by fire trucks?
Good question.
It's private.
They're not required to keep it open, I don't know, so if,
That'd be a planning board thing?
yeah, I'm not sure if that's,
That's a good question.
Yeah, it is a
Yeah.
good
Maybe we
question.
should
Because-
ask planning
Yeah.
board.
yeah, I mean, I can ask them, or ask the fire department.
Yeah.
If they have to have that road or not. But the town departments were all aware that the road was being closed, so I kept them all like in the loop as far as what was going on. so they all knew that the road was being closed. Right now, it's open though, so it's not an issue anymore. Hopefully, it won't be in the future, but they'll have to work it out as far as how, if they need to remove the beavers.
Anything else?
I just, oh, good, you have something?
Please.
No, I do, but that's good.
Susan, there was a complaint here regarding a citizen keeping of chickens. Is
No,
that,
that's what I was gonna ask.
yeah, has that
Yes.
been resolved?
Yeah, they applied for a permit.
Okay,
We have an inspection there next week.
great.
So hopefully they'll be at the December 11th meeting,
Okay.
or if she can't make that, they'll be at the January meeting.
All right, thank you.
So that was my question. I actually have a comment, and maybe we can take this afterwards, but, there's a couple of instances where people are skirting around the permitting of chickens. And I thought it was a good time to maybe, before the spring comes up, maybe a good time to look at the
The regulations.
the regulations and the bylaws to see if they need to be revamped at all.
Yeah,
And maybe they don't need to be.
no, they definitely do, I
Right.
think. So we have done that. I had Sam working on that, and she's done some research
Great.
on the animal regulations. The only thing is, and I mentioned it to Wayne, I would like to form a subcommittee.
Yeah, I think
To do that, so that subcommittee is familiar with it and they can make recommendations before it actually comes to the board.
Sure.
So instead of just saying, here it is, you can, at least the subcommittee can look at it. So if you want to, if you want it, that's up to you. If you want to form the subcommittee tonight, we can do that, or we can do it later on. But I would really like to have a subcommittee for that, so we can talk through what the proposed changes.
I don't think that our chairman would mind, if we want, if someone's interested. Are you interested, or somebody?
I'm
I would be
interested.
interested in it.
I just can't do it for,
I can.
It shouldn't take a lot of work
Yeah.
anyways, but I'd be interested in
yeah, I'm thinking,
participating, or even
maybe we
reviewing
can
if it's
meet-
not.
Yeah, in early January
Yeah,
or
sure,
something
that'd
like
be
that.
Okay.
Yeah, so
So-
David and,
then I'm out.
And you're out, okay.
I won't be
You'd
here
interested
after
in
that.
Is
That
it
would be cool.
David and
both
Mary
David
Beth.
and-
Okay.
What? Oh, he's starting,
sorry, I don't
bringing
wanna
in
go
Wayne
foul.
Don't get
jokes.
so foul.
I don't want to go foul here.
Bringing in Wayne jokes.
Yeah,
Yeah, I
I'm
know.
bringing Wayne. Wayne is not here, but I think
Oh, I
that.
get it.
One other discussion point, I have asked Christine to look into the possibility of this board for our staff acquiring, and for the MRC, and for emergency situations, acquiring a vehicle. We have not had a car, truck, or van for more than 10 years. It's getting to a point where our MRC is moving equipment all the time. When we deploy for emergency drills, we have to run out and buy and rent a vehicle. In an emergency situation, our abilities to rent a vehicle is gonna be zero. And this is not an argument, but just an observation, that most other departments within this town have vehicles. We have not had one in many years. It's come to a point where we are an integral part of the safety of this community, and we need to be able to deploy. We need to be able to move equipment, even for the environmental engineer and for a health agent in certain situations, and we just can't do that. So I've asked Susan to look into the possibility of putting in a capital request, which would go in sometime in January, maybe a little bit later for the capital budget committee, and that when you have some type of a proposal, that we can approve it. And I think we need to go forward, because clearly, we're doing so much in the area of emergency planning. I see that our environmental engineer was at I have it here, you were in an emergency planning meeting, just a municipal vulnerability preparedness program meeting. And since we're so involved in that type of preparedness, and we drill in that area, I think that we need to put the town on notice tonight, for people who are watching, that we are going to need. And I think that Susan thought that she would look into the possibility of a van or something, possibly a four-wheel drive for emergency situations. So it'll be on our decision when she puts a proposal together, but I wanted to make you aware.
Thank you.
Great, yeah.
Okay.
It's a good idea.
I guess I need a motion to approve the Director of Public Health report.
So So moved.
Second.
A motion second, all in favor?
Aye.
I think that's it. Are there any other discussion?
No, thank you.
Motion to adjourn?
I have a motion to adjourn, is there a second?
Don't need a second.
All right, thank you. All in favor?
Aye.
Good night, everybody, and as Dr. Saltz would say, please wash your hands and have a good evening. Thank you so much.
You too.